Hi everyone and welcome to my tennis elbow presentation. Today I'm going to talk about what is tennis elbow, some of the symptoms, causes and treatment techniques that you can do at home. Tennis elbow, also known as lateral epicondylalgia, is a common painful condition of the outside of the elbow caused by overuse of the muscles of the forearm where they attach into the lateral epicondyle, which is basically that bony bit on the outside of your elbow. The muscles around your forearm are primary wrist extensors and weak elbow flexors, so their main role is to lift the hand up and weakly bend the arm at the elbow. Most commonly, the extensor carpi radialis brevis muscle is involved. This muscle attaches from the lateral epicondyle, so the outside of the elbow, to the base of the third finger. Some of the other wrist extensors may be involved too with tennis elbow. When the tendon or tendons are overloaded, small microtears may occur and multiple microtears can lead to degenerative changes within the tendon. The tendon tries to heal itself but is unable to because of the increased load placed upon it. The cause of the injury varies, but altered loading patterns are a common theme. Most patients don't actually play tennis, but when the injury is caused by playing tennis, it's the backhand stroke that leads to excessive loading of the tendons at the common extensor origin, so that lateral epicondyle. Since racket frames became lighter and coaches started teaching the double-handed backhand stroke, tennis elbow has become less common in tennis players. And many tennis players also have a weekly training and playing routine that regularly loads the tendons and keeps them healthy. Most typically, tennis elbow occurs in people that suddenly increase activities that may overload the wrist extensors. For example, gardening, painting, or even just carrying heavy luggage on holiday, which is basically going to overuse a previously underused tendon and possibly bring on tennis elbow. However, tennis players and people who exercise regularly and working tradespeople who regularly load the tendon are also at risk of injury if the load suddenly increases or they decrease rest periods between loads. Other causes of tennis elbow may be incorrect grip size of racket or incorrect racket weight or string tension. Poor tennis backhand stroke can also be a contributor to the cause of tennis elbow. Some of the signs and symptoms of tennis elbow include tenderness or pain over the lateral epicondyle, so the outside of the elbow, and that pain may also travel down your forearm towards your wrist. You may get pain when lifting or bending your arm, pain when writing or gripping small objects, for example when holding a pen, pain when twisting your forearm, for example when turning a door handle or opening a jar, and you may get pain and stiffness when fully extending your arm. There are a couple of videos to follow of tests that you can do at home to confirm whether or not you have tennis elbow. The first test you can do for tennis elbow is resisted middle finger extension. So you want to pop your hand down on a table or something, bring that middle finger up towards the sky, and you're going to push it down with the other hand while still trying to keep that middle finger up. Now, if this causes pain or discomfort around the side of the elbow, then this may be one positive test of tennis elbow. Another test you can do yourself for tennis elbow is resisted wrist extension. So if you pop your hand down on a table again, you want to clasp your hand into a fist this time, bring your hand up to the ceiling and in towards yourself while still keeping the forearm on the table. Now you want to push down with the other hand, create a bit of resistance while still keeping the other hand up. Now in this position, if that brings on pain or discomfort around the side of the elbow, then this again may be a positive test for tennis elbow. Now moving on to some treatment techniques that you can do whilst at home to help with tennis elbow. Now, the first thing that I'd advise is avoid or decrease any activity that aggravates or brings on more pain around the outside of the elbow. Now, if you are unable to decrease the load on the tendon for any reason, I'd advise wearing an elbow support to help with the pain and take some pressure off of the tendons. Like one shown in the video, you can purchase these from Amazon or somewhere like that. But try and avoid wearing the support for physio exercises. Next, I'd advise to ice the area if it is painful for around 10 to 15 minutes a couple of times a day. In the videos to follow, there are a couple more treatment techniques that you can try at home. So one of the ways that you can can treat tennis elbow yourself at home while you're unable to see a physio or sports therapist is by self-massage. So if you get a little bit of lotion or oil or moisturiser, something like that, you can do this every other day for about 5 minutes. What you want to do is just massage around those wrist extensors. So maybe try and avoid the really painful bit around that bony area of the elbow, but just massage the forearm muscles in circular motions like this, up and down. You can go all down the arm and up again. And just try and avoid the really tender spots, but really try and get into that muscle bulk. Now this is going to help release some of the tension around this painful area if these forearm muscles are nice and loose. So just in circular motions around, maybe going up and down, even using your thumb to go up and down the muscle if this feels comfortable. Every other day for about 5 minutes. Another treatment technique is stretching out of the wrist extensors. So just like the massage, you want to try and release some of the tension and loosen off these tight muscles. One way you can do this is by wrist flexion. So you want to pop your hand out in front of you, point your fingers down and apply a little bit of pressure. Now hopefully in this position you should feel a stretch all along those forearm muscles. If it's really painful, just take some of the pressure off. Hold this for about 15 seconds and try and do this little and often throughout the day. The last exercises that we want to concentrate on for tennis elbow rehab is eccentric exercises of the wrist extensors. Now in one of my last videos I mentioned that every exercise has a concentric phase and an eccentric phase. The concentric phase is where the muscle shortens and contracts, and the eccentric phase is where the muscle lengthens. And this is the part that we want to concentrate on for tennis elbow rehab. Now try this exercise first without any weight, and then if you feel ready to and pain allows, add in some light load. Place your forearm onto your legs or on a table or something, lightly bend your elbow and let your wrist hang off the side. Clasp your hand into a light fist, and you're going to lift your hand up with the other hand and slowly lower it down on its own. And again, repeat, lift up with the other hand, slowly lower it down. So we're concentrating on that lowering phase. If this feels okay doing this, no pain, and you feel ready to, add in a little bit of weight. So start off nice and light, and I recommend about 1 to 3 kg dumbbells, or if you've not got any dumbbells, use a bottle of water, something like that. Again, lifting up, lowering down. You want to do this 15 reps for 2 sets, twice a day. You want to do this for about 4 to 5 weeks of just concentrating on the lowering phase. Now, once you've done that, and it's about 4 to 5 weeks and pain is improving a little bit, you want to concentrate on the upward and the downward phase, so the concentric and the eccentric phase of the movement. So again, with the water bottle or the weight, bring your wrist up on its own and down, and repeat. Again, you want to do this 15 times for 2 sets, twice a day. Finally, moving on to a bit of advice and prevention. So try and avoid any sudden increase in activities that involve the wrist extensors, for example, racket sports, gardening, painting, etc. Try and increase the load gradually and include appropriate rest so it gives time for the tendons to adapt to the load and heal. Try and use lighter weighted tools or rackets if you can, and enlarge their grip size to help you avoid putting extra strain on the tendons. Keep up with the exercises to stretch and strengthen the forearm. Start off with the eccentric wrist exercises, progress to the concentric and eccentric exercises, and then when you're ready, you can start to include some more exercises that strengthen all of the arm, for example, bicep curls, etc. Now, I hope this presentation was helpful. If you've got any questions, please drop them in the comments or feel free to give me a message. Thank you very much for listening.